How's everyone's preparation going? Any concerns that you would, because this is probably the last current affairs class. After this, we will have a few sessions, but those will be revision sessions. So in terms of strategy or anything that you are concerned with, anything that is causing anxiety or confusion, probably we'll begin with that and proceed to the last lecture.
Sir, I have one query.
Yes, Bhago.
Sir, I think it's almost I've completed for once, except
Hmm.
history, major
Okay.
subject. But when it comes to revision aspect, I get a bit of anxious because I'm not sure if I would be able to do whole of it in 2 days before exam, and I've hardly, I guess, 60 days left, 65 days. So, except history, if I consider that, then I have probably 1.5 month left.
Did you say 2 days or few days?
No, not. I mean, 2 days or few days. If that comes, I'm
Oh, you
really
mean
not.
to just before the
I mean,
exam, you
just
want to?
before the exam. Yeah.
All right. Is there someone on this class on this meeting who has previously cleared prelims and want to volunteer and address that issue? I don't know if the seniors are attending this lecture, but anyone
Yes,
else?
sir.
Yeah, please address that issue.
I might say that the just follow the program, you're good to go. I only did that and scored pretty well.
Okay. So, did you previously have this issue, Tarun?
Yes, sir. In first attempt, I wasn't able to clear the prelims,
Okay.
but then I just stick to this Anirvesh prelims program.
Okay.
Yes, sir, and I was able to do it.
Okay. From a practical standpoint, I'll address that. Yes, Neha, you can give your 2 cents here.
Yeah, sir. So last year it was my first attempt, and I just
Okay.
stuck to the program, did all
Okay.
the test, and that was the only thing that I. So it's possible even in first attempt. If you stick with the plan, it'll help you immensely.
Okay. Thanks, Tarun and Neha, for vouching for the program. But from a practical standpoint, if I have to address the issue, I'll try to break down the problem, not directly jumping into the program right away, because I'll have to address this concern before moving forward. See, the problem statement that we're dealing with here is, let's say you have 2 days of time before the exam and you don't know how exactly you should be revising your stuff. Everything feels very bulky, voluminous, and very overwhelming. So the last 50 days of the program, it should be in such a way that you are tuning your mind for problem solving. Now, what do I mean by that? Till now, you have constantly been in a phase where you are just consuming information day in and day out. Okay. As a result, your mind is not tuned to think. The main problem of most of the aspirants when they're seated in that examination is that when they are tested, as in when they are forced to think, because 45 to 50% of the questions will force you to think rather than just recall. And as a result, it makes you anxious. I'm telling you right now is just focus your entire energy on training yourself to think with the limited amount of information you have. Why is it like this? I'll just give you a context. See, as a bureaucrat, you're always working under a scenario where there is limitation of resources. If you have 100 information, everybody can just memorize and mark the answers right. But that's not how usual exam works, because that's not how real life scenario is. If you have enough resources to cater to the entire population, there is no need of managing those resources because everybody can take whatever is available there. But in real life scenario, that's not the case. This exam preparation is a simulation for what is going to be a real life problem. You have limitation of resources, and with that limitation of resources, you are supposed to manage the entire population. Similarly, no matter how much information you consume, you will always have the shortage of information because that is what is expected from you. Your ability to deal with your panic, with your emotions, and acknowledging the fact that there will always be shortage of information. Guys, is there any disturbance in terms of video or audio?
No, sir.
No, sir.
Is it fine?
Yes, sir.
Okay. Now, before this lecture, I want you to understand why we have to understand the elimination tricks, as most of the YouTube is filled with all this elimination tricks. I'm not going into the specifics and tune you to this elimination tricks or tell you that these are the mantra that you can follow to magically clear the exam. No. But I want to tell you why elimination tricks is non-negotiable. Firstly, like I told you, you never know 100% of the paper. It's a game of relative accuracy, meaning you just have to clear the cutoff, and that uncertainty will always be there. And UPSC pretty much deliberately frames the questions, almost 50% of the questions, to test this logic element. And it's not an exam of recall. Having said that, you need to be aware of certain facts which were already asked in the examination. And throughout this course, that is what we exactly did. We trained our minds to consume those limited amount of information, the bare minimum that you are supposed to know. We focused on that and started mastering all that. So in a 100-question paper, knowing just 45 with confidence and leaving out the rest is not going to help you clear the examination. We all know this. And as the exam gets difficult, the number of questions which are 45 might come down to even 30 also. You should not panic. So this exam is all about how you manage your emotions. That's all. Okay. Moving forward. So I'll tell you some principles that you are supposed to apply within this lecture itself. From the first, I told you how we are supposed to eliminate. In one of the first videos, I've given you a simple algorithm, LEUNA. I call this the LUNA framework. The order of elimination for any statement is ultimately based on logic. Okay. What becomes logic, what becomes illogical is awareness of facts. As we move away from this first till the last, the awareness of facts reduces. See here, if you're eliminating a statement because it feels very illogical, it is because 100% certainty is there with respect to that statement. You know for a fact that this is wrong. As we move from the first to the last statements, the amount of probability or the probabilistic accuracy comes down. So let's say you all know this extreme worded statements are wrong, usually. But you can't say it for certain in 100% of the cases because it is not possible for you to know everything in this world for certain. So UPSC can come up with exceptions, but usually what is the probability of this being right? It need not be 100%, it can be 90%. And under an organization, if a statement if a statement is made in such a way that a so-and-so initiative X comes under this specific organization or this specific ministry, usually this kind of statements are it's changed by UPSC. That changed. But having said that, is it true all the times? Need not be. We are looking at the previous year data and looking at a probabilistic arrangement, and we are saying that hey, there is an 80% chance that UPSC can change this. Similarly, the next level of accuracy is for numbers. If there is a number, UPSC doesn't usually expect us to remember random numbers. Okay. So that can be 70%. And if the statement has, the word all, the accuracy of that statement will again come down. I mean, like the probability of that statement being right will again, more or less, let's say 50% of the times it can be right, it can be wrong. So I am creating this framework based on the available data till now. I'm calling this the LUNA framework. Logical statements should be accepted first. Illogical statements should be removed. Extreme worded statements will be removed second. If there is an organization name under an org or under a ministry, that is given the third priority. The fourth priority is the number. The fifth priority is the word all. All of them are tied to the first principle, that is logic. How is a statement wrong or right? Ultimately, it's the logic that decides it. Okay. The way we can decide that statement is right or wrong or logical or illogical is, again, like I'm telling you, dependent on the factual awareness we have. And we can't read everything under the sun. So we are using this framework or EUNA to justify that this statement, let's say, for example, all schemes of the government aim at poverty alleviation. So we are saying that, hey, this statement is incorrect because it doesn't make sense because of this word all. Again, this all statement is tied back to the logical part. Number, let's say, for example, if we say that all schemes of the government aim at transferring some X amount of money to your bank accounts, doesn't make any sense. It can be any number. So we are tying it back to the logic under an organization. Let's say, for example, take a look at this. Biodiversity Act 2002 is implemented by Niti Aayog. Why would Niti Aayog implement an act? Again, we are getting back to the logic. So we are using the statement, or UPSC changes the ministries, etc., to make certain statements illogical. And this is the framework usually followed by UPSC. Okay, yeah. The law of trend logic. Let's say, for example, UPSC tests your grasp of directional trends. This is the most important thing for economic survey. I want you to please pay attention on this, not the exact data. The reason why we are talking about all this is, one, because this is the final class, and two, because this directional trend grasping is extremely important in reading economic survey trends. Now, one more thing. Usually, a lot of people make certain mistake. Let's say, for example, you have heard a term in news. Let's say, for example, you have heard life, mission life. Just because you heard it and it is placed and it feels like this can be a possibility, you take a blind guess. UPSC wants to, put words like this, current sounding words. Especially the danger is very high if you are reading some compilation and just applying them blindly. So always concept is the first savior. Then comes all these tricks and techniques. So I hope you understood the Luna framework of eliminating statements. You can apply the same logic and for assertion and reasoning based questions. Usually it is noticed that both A and R are right and the reason doesn't explain A. So how do you figure out if the assertion reasoning statements are placed between option A and option B? That is, the reason is explaining the assertion or the reason is not explaining the assertion. The prerequisite to know this is the factual awareness of both assertion and reason. You should know that both are right. How will you know that? Again, basic static textbooks or the content that is given to you and a clear grasp of the PYQs. All the PYQs and the information therein should be on your fingertips to get these right. It's a prerequisite. Otherwise, there is a danger of you faltering. With this context, let's begin the economic survey. Okay, final mental checklist. So how do you go about this? If you know 100%, you'll mark it confidently. 50%, just focus on eliminating what you feel is impossible. Again, to get these right, revision of your facts. The so-called silly mistakes. If you call these silly mistakes, there is a problem in your attitude. These mistakes are something that you can never get wrong because they are within your range. By calling them silly mistakes, all we are trying to do is pamper our ego because this should be strategic blunders. You should not call them silly mistakes. You are trivializing these mistakes by calling them silly. Instead, call them blunders because it is absolutely unacceptable to make mistakes, which is pretty straightforward. For example, if you are not sure if Puttaswamy judgment is about Article 21 and 19 or 19, it's unacceptable. And why do people score a lot of negatives? Because they don't practice this third principle. If you don't know something, neither the logic nor the fact, you are not supposed to touch it. For example, you will see some questions every year which will appear in, let's say, for example, that bee dance, the waggling of tails, or some random facts that can appear from Hindu. If you are someone who is an animal enthusiast, good for you. You will understand those topics. You will be able to take them seriously and guess it. But for most of normal people, it's a very random fact. You're not supposed to chase them. Instead, if you get normal questions wrong, and call them silly mistakes, it's unacceptable. So just focus on these, reducing this so-called silly mistakes, or rather call them blunders, and focus on this third principle. Avoid touching something that you're absolutely unaware of. It's okay to take a guess when you have a certain, at least in your mock test, you need to have a solid reasoning as to why you are attempting it. If you don't have any reason, the reason can be wrong. So if you make a mistake in the mock test and you find that your reasoning is wrong, it's an opportunity to learn and, revisit that concept and revise it once again. But if you're attempting it just like that because you don't have a logic or don't have a reason as to why you attempted it, it's a very poor strategy. Don't do that. So this is the time where you're using PYQs, static material, minimalistic way, and focusing on this third thing. This is what helps you in improving your accuracy. The third principle, and reducing the so-called silly mistakes by revisions, multiple revisions of the same thing. Which things? PYQ facts. You might be wondering, why am I focusing so much on PYQs? Because they will inevitably repeat. Let's say, for example, if I'm not wrong, in 2022, there was a question on T-board. Is it 22 or 23? I don't remember the exact. T-board is present in Bangalore or something. I was just going through some material and I noticed that in 2008, the same question was asked, wherein they asked it in the format of match the following. And the only way you can get that answer right is just by eliminating the fact that one option, one pair of match the following. That is, they gave T-board headquarters as Delhi or something, if I'm not wrong, or they must have given it right. They must have put the right Kolkata or something. Just by knowing that one fact, you will get that question right. The same logic applies in this 2022 or 23 question also. So PYQ information, having them on your fingertips is a prerequisite to clear this examination, not any random newspaper article or anything. I'm a current affairs faculty and it would be in my best interest, but no, my bigger interest is you clearing this exam, guys. So don't chase random material and run after random materials and mug up all that information without any outcome. Every action that you do should be mapped to an outcome. That outcome is you clearing the exam, and the action should always be PYQ centric, and that is how this course is designed. And that is the reason people who have already cleared this examination, it is easing their burden, it is easing out their pleasure. So whatever information that I've picked from newspapers or anything, it's curated based on this PYQs only. Yes, I might miss some information, but it is not going to decide your selection. It's okay to miss some information. It's fine, because 100% of the questions nobody can predict. All you need is 50% to clear this examination. You just have to be above the cutoff. That's all. Even for IO4s, that's the same logic. Moving on. We'll go back to the economic survey. I've already explained 4 lectures. I've already posted on the YouTube as well as on the portal also. And in this last lecture, we will be focusing on trends. This is the 11th chapter from of economic survey, the social sector. And I am curating this information in tandem with how UPSC has been asking trend-based questions. So you have to remember this like a logical flow, right? So for that purpose, I'm going to break down the entire social sector explanation into various steps. What is the purpose of economic survey talking about social sector? Simple words, inclusive growth. This is a syllabus pointer, okay? Because ultimately, the purpose of growth is to improve the quality of life, right? And empower people. So that is exactly what this chapter is talking about. So if you want to understand the funda here, inclusive and sustainable growth aligns with our vision of what constitutes Vikasit Bharat. If we have a Bharat in 2047, which is extremely wealthy, but 90% of the population do not have access to basic health, education, social security, what kind of a quality life are we talking about? What kind of a growth are we talking about? It's not something that we need to encourage. So this is the foundation on which the entire understanding of social sector is based, and the focus areas are given here. So the trends, focus on the trends, not the numbers. Be very careful. Look at this. Government spending on social expenditure. Is it increasing or decreasing? Of course, it is increasing. That's why there is a rhetoric on government expenditure, increasing the freebie culture, etc., etc. Because the governments, the politicization of this whole welfare expenditure thing is actually causing a huge burden on the exchequer. Okay, this is the thing. With respect to our education, the spending is actually increasing year on year at a compounded annual growth rate of 12%. The numbers are not important. Just understand the fact that it is increasing. Health, 18%. Education, 12%. And despite this, are we witnessing outcomes? What is the outcome? Let's see. With respect to consumption and inequality, we have to understand monthly per capita expenditure. If we want to see inequality, one of the metric is how is it between urban areas and rural areas. So the survey says the gap is decreasing between urban and rural areas. So what does this imply? The tier 2 growth or the tier 2 towns and cities, it's increasing. The ability to spend more money is increasing. So Gini coefficient, anybody? What is Gini coefficient?
Measure of inequality.
Yes, Gini coefficient is a measure of inequality. Both in urban and rural areas, the situation is getting better, which is indicating that our expenditure, that is the social expenditure, is actually translating into outcomes in the terms of Gini coefficient or reducing of inequality. You have to understand this trend. Why is this happening? So this can be an assertion and reason. What is the assertion? Gini coefficient is improving. What is the reason? Higher public spending and redistribution via public distribution schemes and other subsidies. Okay. So this is the assertion and reasoning, the first part. Moving on. Let's look at each sector. When you are looking at health, education, women, etc., I suggest something called the life cycle approach. See, it is very difficult for you to remember random information if you don't have a structure to that. How do you give structure? By following this so-called life cycle approach. From the time you take birth till death, we progress and pass through different stages in life, right? Whether it is school, whether it is health, college education, adult life, or to that matter, even the old age, different phases. We have different needs at different phases of our life. When you take this life cycle approach, the concept of what we discussed as intersectionality, anyone who is a part of the full length program or the Samagra Samarthan, they will understand. We have discussed this concept of intersectionality in our society. What do we mean by that? If there is a problem, let's say, for example, if there is a problem of caste, imagine a certain individual is from a lower caste. They have a discrimination in form of caste. Add to that, there is gender bias. Add to that, there is physical challenge, that is physically handicapped. So all this together will constitute multiple disabilities, and this multiple disabilities will make the quality of life much poorer. This phenomenon is called intersectionality. When you follow this life cycle approach, you will be able to appreciate this much better. And I want you to understand and appreciate that you should not look at education, health, etc., and the spending therein separately. While we are focusing on these facts on a practical level, never ever forget that in life, it is rarely a choice between do you want health or education. It is health and education and skills and jobs. It is not an option to just focus on one thing. You have to focus on everything. With that understanding, let's focus on education sector. We have the National Education Policy, which aims at 100% gross enrollment ratio. Are we talking only about primary? Did we already achieve the gross enrollment ratio of 100% primary level? Almost near universal. Okay, thanks to the Sarva Siksha Abhiyan, we've already attained that. And the most important thing, which was hitherto not addressed or ignored completely, is the early childhood intervention. That is between the ages of 3 to 6, pre-primary schooling. Because this is the time where 85% of the brain development happens. Children need to be given proper nutrition, proper training by this age, because otherwise it becomes very difficult for them to grasp a lot of things. So the most important trend that you need to focus on here is the dropout rate, which has been decreasing. Why? Because we are giving them enough incentives, and that is what the survey says. Not important to remember all these numbers, 77, etc., etc. Okay. Just understand that we already have a near universal gross enrollment ratio. At the time of COVID, because of the lockdown, many states saw a decline in enrollments, but that is changing again. We have reversed it and we are getting better. This is what the survey says. And certain initiatives are given. See, at different ages of our life, we focus on different methods of learning. So the most important thing is the foundational learning, that is your basic math, language, etc. This is what Pradham, an NGO, which talks about the quality of education and educational outcomes through its ASER report, Annual State of Education. Okay. So it talks about how the foundational literacy, let's say, for example, across different years, this report has flagged the lack of basic foundational skills. Let's say, for example, if you ask a kid, what is the time? They're not able to tell the time by looking at the watch. They don't have the basic math skill, language skills. They're not able to read. And yet they're finishing their primary schooling. They're finishing their we have the right to education, and the right to education, which is a legal right now, is just focusing on enrollment. Is it focusing on outcomes? Not yet. So we need to move away from looking at education outcomes as an entitlement, not enrollment. This is what Pradham says. And to address that, there is a scheme called Nipun Bharat. Okay. So it talks about achieving this near universal fundamental literacy or the foundational literacy by 2026-27. Okay. And the survey talks about World Health Organization's framework called the social emotional learning, which consists of 16 life skills. You don't have to remember all those 16, but just recognizing is good enough, because kids are not just mere tools who become the workforce of the future. We also have to imbibe certain value system for the future, because that is what we are made of. So there is something called Tim Tim Tare initiative, which teaches soft skills, activity based learning. A lot of schools in international curricula, they moved away from rote learning and they focused on activity based learning. Why is it that we are not focusing on that in government schools? This initiative is trying to address that. And in a world where we are increasingly using AI to reach the masses and focus on outcomes, digital integration is a very big theme that can be asked. So you have the usual themes like Diksha, E-Vidya, or PM Disha, Swayam. This were asked in the previous years. Same thing has been mentioned again. You can just go through the material that I'm going to give you. You have to memorize, that's all. There's nothing much to explain here. But the theme of digital integration across any sector, any social sector, whether it is healthcare, whether it is education, whether it is insurance, we are talking about digital services. Wherever you would notice a digital integration as a theme, that becomes important, because we are using information and communication technology as a tool to solve a problem and reduce corruption and manual interface. So UPSC wants to test your awareness of those factual information, especially given the fact that they're addressing fundamental problems of that sector. For example, if you are in a very remote tribal village, you don't have manpower, and you want to teach those kids something, they don't understand your language. What if you can get an educated professor who is aware of that language, teach them, record it, and telecast it in that school with one mentor who is actually facilitating learning, who might not be a subject matter expert, but is good enough to engage the kids and mentor them on how to go about it. That is the power of digital integration. And you're expected to have awareness of these basic information. So what themes to focus on during revisions? Anything like digital integration schemes of the government, it is a potential question. But what is the most usual mistake that people do? They don't focus on the purpose. Otherwise, they'll get confused, right? So when you're reading something, focus on what problem this initiative is trying to solve. And to remember that you need to know the entire education sector as a proper workflow. You need to know the entire policy requirements of that education sector from school level till PhD. So it should be prepared like a continuous process, not in silos. That is when you will be able to appreciate each initiative. Let's say, for example, within the school, if this particular scheme is addressing a problem, another scheme will address another problem. One is addressing teacher attendance. Another is addressing ensuring accountability of, let's say, ICDS kind of a platform wherein students are getting proper nutritious food. All of this is digitally tracked on a single dashboard at the district level. You need to visualize like this and be an actual problem solver to solve this prelims paper. If you just sit down and mug up day in and day out, you're going to suffer. Higher education, what is the trend here? Take a look at the enrollment ratio. It increased. See, a survey will focus on improvements largely. If there is an anomaly, focus on that anomaly, because that is a very likely question. Otherwise, don't try to remember anything, all these numbers. Gross enrollment ratio increased. IITs increased. IIMs increased. Higher education institutions increased. But what is the problem in higher education? This is what I want you to focus on. Don't waste your memory for all of this, because it's not going to be important at this point of time. Maybe during mains, you can use this data to substantiate your answers. But right now, that's not the thing. The most important focus is higher education has a geographical bias, because most of the institutions are there in South India. And the specializations are skewed. Like, say, for example, if you want to do a master's in forensics, you don't have the necessary infrastructure to produce world-class talent in that. We are more tuned to catering to the mass markets. That's why you have a lot of engineering colleges, because that creates jobs. But thanks to the structural changes that are going across the world, let's say, for example, AI. If indeed AI is going to reduce the dependence of engineers, what is the next frontier for producing jobs? This is a big question that is meant to be addressed, right? Now, take a look at this. Next, health sector. Again, like I told you, government health expenditure increases. Out of pocket expenditure is reducing. So you need to focus on this anomaly. Don't blindly say that, everything is increasing. etc. Focus on the logic here. If we are spending more money, and if government is also spending more money, what does it mean? Where is the money going? The whole concept of social expenditure in the health sector will be defined if out of pocket expenditure is also increasing, government expenditure also is increasing. We are talking either it implies two things: either we are a very sick nation, or two, we are inefficient in managing our health expenditure. So this should be our logic. So focus on the fact out of pocket expenditure is reducing according to the economic survey, and the whole health policy rests on these pillars. It is better to prevent and prepare than repent and repair. So preventive national health care, this is what we have to focus on. Okay, both communicable and non-communicable diseases. And for this, you have the National Health Mission. If there is something that is problematic, it is the lifestyle diseases. After the age of 35 or probably 30, we have to detect there is a growing importance of non-communicable diseases and screening. And for the population that has already been diagnosed as sick, we need to make medicines affordable. And for this, you have the Jan Aushadhi Kendras, the generic medicines. And finally, it's about the physical infrastructure. Okay, especially in the rural healthcare sector, because the doctor to patient ratio in India is very skewed. Healthcare professionals are severely understaffed. And that's a problematic issue. Survey talks about certain initiatives, again, digital initiatives. Let's focus on them one after the other. Technology integration, like I've told you, is a very important theme. First one being Ayushman Bharat. What is the way to remember all this information? Like it is a problem that is meant to be solved. What is the problem this is solving? Right now, let's say, for example, if you want to have a integrated database at one place, you don't have it. What database am I talking about? Let's say you want to enter a social security number, let's say just some number, Aadhaar card number, and want to know the health status of a person. All of us might have taken health checkups across the country at different points of time in our life. Let's say if a diabetic patient underwent a 3-month diabetic checkup, HbA1c as they call it, and they want to track their record of what is happening 3 months later. They've lost that report. The diagnostic center, which is supposed to maintain that record, has not linked it to some social security number or Aadhaar card. We don't have a mechanism which can tell us what is the health status of a person. This fragmented health data is actually limiting our ability to offer healthy services to the patients of this country, and therefore universal and equitable healthcare delivery. So when we talk about public health, we are usually focusing on MBBS, but rarely do we talk about the interface. Recently, there was an article in the Hindu. It's a very beautiful article. The idea of public health is just limited in the public imagination to doctors, nurses, hospitals, etc. They don't talk about preventive healthcare. They don't talk about professionals in the social sciences who are trying to educate the masses of what a good quality, healthy life is all about. This includes even mental health as well. Even today, talking about mental health is a very big stigma. So we don't have effective patient data, and that problem is being solved by this Ayushman Bharat digital mission. Now, there's a caveat here. If you are not focusing on the nuance, you would link the Ayushman Bharat insurance scheme, that is Pradhan Mantri. Can anyone tell me what is JAY? Anyone?
Jeevan Arogya Yojana.
Sorry?
Jeevan Arogya Yojana.
Not able to hear you.
Sir, Jan Aushadhi Yojana.
Is it Jan Aushadhi Yojana?
Pradhan Mantri
Jan
Jan
Arogya Yojana.
Yes. What is Jan Aushadhi Yojana? What is this about? Do we have a Jan Aushadhi Yojana?
So maybe it is connected to generic medicine.
What is the scheme called for generic medicines? You've already seen that. Anyone? Exact name. See, you might get, especially people from South, if you are not aware of Hindi, you might make a lot of mistakes and you might get confused in this. So one of the mistake that a lot of people do is there is an insurance scheme. Okay. Ayushman Bharat insurance scheme, universal health insurance of 5 lakh rupees. Is it per person or per household? Person or household?
Household.
What is the traditional definition of a household? How many people? Okay, take that as a homework. Okay, you can research and take a look at the website. It is not an insurance coverage. This is a completely different thing. Ayushman Bharat digital mission is a different thing. So go to the website. I can give you the information, but my job is to just raise questions and create that curiosity so that you at least visit the website of these respective schemes and look at the About Us section. That is how you will retain a lot of information. Okay, moving on. Then we have the UWin platform. Am I talking about the CoWin? That's a different thing. Don't confuse this CoWin platform, which is a platform meant for COVID vaccination with UWIN. It's a universal immunization program. Okay, I have a question. How many of you are aware of Mission Indradhanush?
Yes, sir.
What is this Mission Indradhanush?
So the immunization program for child.
So
For everyone.
universal immunization.
Universal immunization. Then what is the universal immunization program? Why do we have a separate Mission Indradhanush? Is this for entire country?
Sir, Mission Indradhanush was implemented in 4 phases, sir, covering certain targeted sections of the population.
So it come under UWIN.
So, as per 4.0, only around 90% of the population
It
was
is
covered.
targeted at aspirational districts. It is meant for those areas where traditionally people were not able to access immunization programs. Or there is a possibility because of a lot of myths, there is a phenomenon called vaccine hesitancy. See, in areas where there is low education or awareness of this, you have witnessed even during the COVID pandemic, a lot of people were hesitant to take vaccines. Yes, I agree that there has been a lot of side effects, and it's valid to have those arguments because the vaccine was created in such a short period of time without much data. Having said that, even in the cases where you have scientific data proven that vaccines are very effective in handling certain diseases, preventing them, let's say, for example, polio, there are still pockets in this country which refuse to take this vaccine. So there is something called mission mode as a governance mechanism. You define the time period, you define the target beneficiaries, and within that time period, if you achieve the target, the state government will probably get some funds as an incentive to roll out welfare programs for the next cycle. So it's an incentive driven format for ensuring that the respective governments achieve those targets. So the mission mode has been the way in which the governance is happening after the NDA government came in 2014. And to facilitate and track the key performance indicators, or KPIs as they're called, we need certain platforms or dashboards to track what is happening. UWIN is that platform which gives us information access about the status of the immunization program across the country. So what problem is it solving? Poor record keeping and inefficient scheduling of vaccination in remote areas. And there is a limited flexibility and access to immunization services, which is causing inadequate vaccine coverage. So we are trying to digitalize it and provide anytime, any vaccine, anywhere, depending on your eligibility to take it. So this is increasing accessibility and coverage. This is how digital technology is solving certain problems in the society within the framework of health. Then we can talk about e-Sanjeevani. 1 second. One more point here. One of our students pointed out that additional thing that I missed here. In this UWIN platform, not just kids, even pregnant women data is tracked here. Please note this. Moving on. e-Sanjeevani. This is the national telemedicine service. What problem is it solving? See, for example, in a remote village, you don't have access to healthcare specialists. Let's say you want to meet a pulmonologist. We have seen this practically during COVID. A lot of villages needed pulmonologists. They didn't have access to that. In the private sector, telemedicine is available. A startup, if you are aware of a startup like Practo, you can just book doctor services there. You will have a video call. They'll consult, they'll see what is the problem and give you an advice. But a lot of doctors in cities, they are refusing to settle in the remote areas because practically the living conditions there are pretty bad, according to these people. So this is increasing the out-of-pocket expenditure because the patients in the rural areas are supposed to travel to the cities, and this is causing a lot of problem. And to address this point, e-Sanjeevani is the national telemedicine service where you will have consultations. So virtual consultations connects the rural areas to specialist doctors nationwide, and this reduces the out-of-pocket expenditure. But remember, this is not just a COVID-specific initiative or only rural-specific initiative. This is a framework which can be scaled across the country, and we should aim to make it near universal. Okay, please remember that. Next being iDrone. This is an initiative of Indian Council for Medical Research. So medical research. Now, what is the problem it is solving? See, when you're trying to prepare a vaccine, delivering those vaccines to, let's say, a remote tribal hamlet, it's a very difficult task. So to handle this logistic hurdles, we are using drones to deliver those vaccines, and the poor healthcare infrastructure to ensure that there is a rapid response in case of emergencies. That problem this iDrone initiative is solving. How is it solving? Drones are used for timely transport of vaccines, blood, and medical essentials. Okay. Now, what can be the usual mistake that people do? Since we're talking about drones, yesterday in the drone policy, we were discussing how DGCA, that is the Director General of Civil Aviation, is responsible for regulating drones. So this initiative can be misattributed to the Ministry of Civil Aviation. Any commercial drone activities, it's an ICMR-led health initiative for medical supply chains. Please remember this. Next up, AI in healthcare. This is termed as the new nervous system. See, usually the problem is a lot of people, they do not get tested. Even if they get tested and if they don't find any health problem, they're upset because it's a waste of money. That's the perception of most of us in this country because they're very expensive. So this makes the healthcare delivery very inefficient because we don't have proper data and we don't have skilled specialists to address this. This is where AI can come into the picture. In fact, there is a specific chapter in the survey which talks about the highest employment elasticity. That is where AI can generate the highest number of jobs. It is healthcare. How? It is not important. Let's not get into the specifics, but healthcare has a huge potential for employment generation by leveraging AI. Okay, so for all this complex medical emergencies and understanding those diagnostic, even there are news, probably New Zealand or some other country, a lot of doctors were not able to diagnose the problem. A person used ChatGPT to diagnose the problem, and when they got it tested, it actually proved to be right. So if you integrate AI, club it with robotics, and then use Internet of Things, in this specific case, Internet of Medical Things. Let's say you send a small device, let's say nanometer range device, instead of actually following a very intrusive diagnostic testing like a colonoscopy. It gives better information, the precise diagnostics, and it can track the data real time in a longer span. So this gives us information about predictive healthcare, disease monitoring, and probably it can also help us in understanding how diseases evolve over a period of time. So again, like I told you, in our framework of eliminating options or the algorithm to eliminate options, after logic, the way in which science and technology questions and the statements can be twisted is by saying that AI can completely replace doctors. That's still not possible. Even if you want to use AI, you need to have a certain context. Yes, AI can augment access, reach, but you still need professionals, medical professionals who understand the context and improve efficiency. Next up, insurance schemes. See, basic purpose of insurance is to ensure social security. What do you mean by this? At a time when you don't have a job, the social security can be pension, it can be health insurance, anything. At a time when you don't have job or a source of funds to facilitate your expenses, insurance comes into the scene. And if you take a look at the employees or the entire population, different sectors have different insurance schemes. Say, for example, ESIC, that is employees. Anyone who is earning 21,000 monthly. I've already covered this in our EPFO series on YouTube in 2020. I mean, you don't have to watch it, but in that I've explained the context. If you're curious enough, you can go and watch it, but probably after the prelims exam, not now. So if you're earning up to 21,000 monthly, you are eligible to get the scheme. And this is for organized sector. Please remember, organized sector. If you are in the central government, let's say, for example, you are a class 2 officer or group A officer, all these employees will get employees, pensioners, and their dependents also will get health insurance on what we know as the CGHS scheme. Similarly for ex-servicemen also, we have one scheme, but for below poverty line, we have the Rashtriya Swasthya Bima Yojana. Now, this scheme is aligned with the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. Please notice this. Don't get confused. It's not Jan Aushadhi Yojana. That's a different thing. What is the most important takeaway? What is the basis here? It is the socioeconomic caste census. Now, we are supposed to have a census in 2021. We are yet to have the process initiated. COVID has been cited as the reason, but caste census can be a theme that can be asked. And in that context, you need to know what all schemes, what all schemes use this socioeconomic caste census. Maybe you can go to the About Us section and see who are the included beneficiaries and who are the excluded beneficiaries of socioeconomic caste census. That can also be a probable question. Mental health. Mental health. World Health Organization spoke about how we are losing a lot of productive days. Number again is not important to remember, but it's a huge number, 1 trillion. And coincidentally, World Health Organization mentioned that the youth are facing this mental health crisis probably because of the phone-based childhood. It's all the more relevant to the Gen Z, a very recent phenomenon. If anybody is facing anxiety, this is a good time during prelims to check your phone usage stats. If you're spending a lot of time on Instagram or any other social media application, this is a good time to recheck. I mean, it's not my place to tell you what you should be doing. If you think your exam is important, you should take this observation by World Health Organization pretty seriously. And anyway, coming back, what are the initiatives and targets? The National Mental Health Policy. See, any policy will try to address a problem and create a solution. The fact that the last policy came in 2014 and still we are looking at mental health as a stigma, it's probably a call for us to relook at our mental health policy and evaluate how to address this problem better. We've had a Mental Health Care Act in 2017, which follows a right-based approach because we all deserve to have a mental health professional address our problems. It's a right-based approach, but there is a social stigma. You have the facility to use it, but we don't use it because of the social stigma. In this context, there is something called Telemanas mobile app. It's a remote mental health support, and this has been in news most importantly during the COVID. There was, an appreciation about how this app has saved a lot of young people, especially during the COVID, just by normal conversations, just by talking. So mental health needs to be taken seriously, and anything that is talking about a digital intervention in healthcare and more importantly, mental health, that can be a probable question. So if you're coming across any news, even in the future, take a mental note that any digital intervention can be a probable prelims theme. Now, lifestyle and non-communicable diseases, again, just like every other trend, sadly, even the non-communicable disease burden is on an upward trend. It's increasing. 74% of the global deaths, 61.8% of deaths in India, 37.9. Major contributors: unhealthy diets, ultra processed food, sedentary lifestyle, and Instagram influences. They didn't add it. I'm just adding it here. Just kidding, guys. Don't include it in your answers. I'm just saying. So most importantly, a sedentary lifestyle has been termed as the biggest contributor. Initiatives and targets. National Program for Prevention and Control of NCDs. It can be cancer, stroke, diabetes, etc., etc. Population-based screening, like I've told you, anyone who is age 30 and above. Previously, this was 50. Now, thanks to our healthy lifestyles, it has come down to 30. How do we deal with it? Health taxes. Let's say, for example, if a particular food is having high amount of processed fat, etc. I mean, every one of us is guilty of indulging in this unhealthy products, including myself. So we need to have a check, at least periodically, to ensure that we are not actively indulging in all that regularly. So we have to focus on promoting life or sustainable consumption, lifestyle for environment. It encourages healthy living practices. Okay. So what SDG is talking about responsible consumption? Have a look at it. Okay. Responsible consumption is not talked about in the context of food, actually. It is about material efficiency. And I'm extrapolating it and saying that, you have to promote responsible consumption of all the snack items as well.
Sir, is it SDG 12?
Yes. Anyway, see, there is a very important term that is being used. I mean, having an awareness of this trend can help you in some way in the exam. I don't know exactly how you will get a question on this, but the word influencer, everybody knows, social media influencer. But what is the meaning of the word anti-influencer? See, a lot of social media influencers, they engage with you. They ask they ask you to buy certain consumer products, FMCG goods, etc., by promoting certain products because of the popularity they have. Anti-influencers are those who call out these influencers and say that, you're actually harming people by asking them to buy this, who intentionally confront the traditional standards or influencer culture. Let's say this guy is has made it to news because he fought how our food labels. Okay, this guy has questioned how marketing or pseudo marketing of many food products, claiming, let's say, for example, Bonvita, it's nothing but sugar. Large extent, it is sugar. It is promoted as a health drink to kids. Nobody questioned it for decades together. But thanks to the increasing awareness that we are not supposed to put a lot of sugar in our body because NCDs are rising. Childhood obesity is a very real thing. We need anti-influencers like this. So recently, in one of the health ministry documents, there has been a mention of a policy where we have to leverage anti-influencers also. So if you get a question on this, maybe it can help you. That's the reason I'm including it here. Now, we're talking about the social sector, and it is inevitable that we talk about the rural economy because non-farm employment in India, rural sector is characterized by dependence on agriculture. And because of this, too many people doing the same thing is a classic case of disguised unemployment. What happens as a result of disguised unemployment? The quality of life comes down because you are not having enough money. So you need to push for a rural economy that is resilient and inclusive. How do we do that? You are given a lot of schemes here. Again, I want you to focus on rural economy and the schemes holistically, as the scheme is supposed to address one aspect of our life. Let's say, for example, you walk out of your imagine you're walking, staying in a rural area and you're walking out. You need a proper road to address that problem. Gram Sadak Yojana. You need sanitation, Swachh Bharat. You need clean water, Amrit Sarovar. You need health, National Health Mission. You need proper governance, Adarsh Gram Yojana. You need proper access to tapped water connection, Jal Jeevan Mission. Okay, there is an interesting article today in Jal Jeevan Mission. See, what is the purpose of Jal Jeevan Mission? To give access to tapped water. So again, this is conducted as a mission mode, like the word itself indicates mission. So let's say you're an officer, you're continuously increasing the number of connections. The problem here is, what if a particular pond, let's say you're talking about tapped connections from a particular clean water resource. That pond is capable of delivering clean water to 100 households. You have to lay down infrastructure to gather water from pond 2 to the next 100 households. But the officer is under a lot of pressure to increase the number of active tapped connections because it will reflect well in governance. What if you are pulling out water from the first pond, which can cater to 100 households, but it is now giving 200 households? What is happening as a result? You have tapped water connections, but they're not being used. It's like the operation is successful, but the patient died. This is where it's important to have a complete holistic picture. This is why Mission Amrit Sarovar, it's important because you need to focus on the sustainability of the source also. Mission mode projects, the biggest takeaway is they achieve results in a very short period of time because of the target driven approach. But the other side of the coin, if they work in silos and they're not coordinating, this becomes a problem. So these two should coordinate, Mission Amrit Sarovar and Jal Jeevan Mission. And at the heart of it, everybody's dream, a middle class person's dream, is to have own house, Pradhan Mantri Awas Yojana. So this is how you would power the rural economy. This is how you empower them. Give them the basic services that improves the quality of life. To be very honest, if all the basic services are delivered and if the villages are clean, the quality of life in those villages is much, much better than in the cities because they have clean air, basic education, good internet. What else do you need? All the basics are taken care of and you have better quality of life. And most importantly, they're not hectic. You don't waste a lot of time in commuting. So the future of work should be decentralized economy. And that's the ideal thing. The city-led growth for a populous country like India is unsustainable beyond a time because we are witnessing every single metro city is overburdened beyond the carbon footprint. This is how we are supposed to think. Moving on. Economic survey talks about the schemes which facilitate certain needs. For example, you're talking about the infrastructure. The PM Janman. This is focused on tribal habitations. If anyone is having anthro optional, you can use this in your tribal anthropology also as a substantiating point. Okay. Okay. Here is an important point. This year's budget talks about a lot of umbrella schemes. Just like how I talked about Jal Jeevan Mission, not achieving its end objective of ensuring people using tapped water because the sources are becoming unsustainable. We are witnessing a trend where budgets are allocated to different missions, but because of the lack of coordination, they're failing. This budget has tried to address that by creating an interconnected framework. Let's say, for example, just a hypothetical example, if Jal Jeevan Mission is addressed with along with the mission Amrit Sarovar, and both of them work in tandem, the end objective is achieved. Similarly, we are witnessing many other schemes like PM Janman. I'll also take a look at other. I'll show you some other schemes also where there is no fresh budget allocation. It is using the existing fund allocation, but together so that there is coordination. That is the biggest takeaway for this budget. We are also trying to localize this SDGs through Mission Antyodaya. Okay. And they're following something called the local indicator framework. Okay. This is something that we have taken from Kerala, which is known for its governance. That's all you need to know. Moving on. With respect to welfare, you already have the Deen Dayal Antyodaya National Rural Livelihoods Mission. You also have the WASH initiative for sanitation. These are all pretty old schemes, nothing new to add here. And I don't think you will get a lot of questions here. Just be aware if they are coming in previous year questions. Free legal aid. Again, Gram Nyayalaya Act. In 2016 or 17, there was a question on this. Maybe again, you can have a question on Gram Nyayalaya Act. You can go through the basics here. Go to the website of NALSA and read the About Us section. Okay. Now, with respect to enhancing rural income. Again, gainful. What do you mean by this word gainful employment? Which improves the quality of life. How can your quality of life improve? When you have the skill and autonomy, that is self-employment. If you want to enhance your autonomy, Manrega is probably not the way because it is meant for unskilled people. But survey talks about how we have to restructure our existing Manrega just by focusing on asset creation in rural areas. What do I mean by this? The biggest criticism for Manrega is that it is a pit digging scheme. That is, a lot of previous governments criticize this scheme because all they do is just dig up, the earth in the rural areas without having any tangible outcomes, just to ensure that the unskilled people are getting some money. And there is a lot of alleged scams and how this money is being dispersed. That has been addressed through this payment system. Okay. And there have been case studies mentioned of how an integrated approach, that is by using unskilled people and making them a part of the asset creation, public asset creation in rural areas. Let's say, for example, nutritional gardens where high value nutritional crops are produced. They're made a part of building infrastructure for animal husbandry, aquaculture. This has improved farm incomes, non-farm incomes in the rural areas. So integration of schemes and efficient utilization of resources is the key takeaway. Next up, demographic dividend and human capital. See, when we're talking about productive youth, this is the statistical number of the number of people who are aged in this. What do you imply here? The number of adults who are depending on, let's say, to simplify this, the whole first point, the number of people who are seeking employment and trying to become independent, they are rising. And therefore, dependency ratio is coming down. In this kind of scenario, we have to provide skills to utilize this demographic advantage. One of the traps that UPSC can lay, or the most usual mistakes that a lot of people do, is misinterpreting this dependency ratio, which is declining, as an economic benefit, because this demographic advantage will become a disaster if we don't skill them. Population growth is not necessarily going to translate into demographic dividend. Because we have a young population in this age group, we have an advantage for a very short period of time. And that short period of time, when you give skills, it gives us an opportunity to reap that dividend. Otherwise, it's a disaster. Please focus on this. So this is the conceptual part. What are the current employment trends? See, again, you would see all the good things increasing, all the bad things reducing. This is the usual trend. If there is something of an anomaly, focus on that. Unemployment and labor force participation. See, unemployment reduced. It's a good thing. Nothing, this is not an anomaly. So no need to remember this. Labor force participation improved. Worker to population ratio improved. Urban unemployment decreased. Good thing. Nothing to remember here. Types and nature of employment. So this can be asked. What is the most dominant form of employment in our country? Self-employment. Then you have salaried class. So here, this is a cause of concern. People are not getting enough jobs. Salary is decreasing. Salary class is decreasing. And here you would see that casual workers, that is hire and fire basis, very impromptu, like this is sharply decreasing. And there is an increase in self-employment. What is happening here? Why is the casual work declining? We don't have a clear picture yet. So what is the most common mistake that the labor force participation rise is assume that there will be rise in quality of employment also. Need not be the case. Let's say, for example, if you're working for 8 hours for a salary of 10,000, that person may not essentially gain a lot of money, but that person might be working for experience and learning the skill. But if it is an unskilled job and you're still working for that, you are actually in a salaried class. You are treated as an organized worker. Or let's say you are getting 20,000. Technically, for definition 6, you are a 21,000. You are actually getting all the benefits of organized sector. But what if that person feels instead of working 8 hours here, I would rather start up my own business and let's say I would start a small food business. I'll make much more. That person will move away from salaried class to self-employment or the casual worker to the self-employment. Okay. So this is the thing. So you should not focus this, confuse with this labor force participation rise as an automatic increase in the quality of employment, or don't misrepresent the declining casual workers as a direct rise in formal employment. This is the mistake done. It can be self-employed also. It can be salaried also. We don't have a conclusive evidence on what is happening here. Just be careful. Sectoral employment trends. See, if agriculture employment is increasing, you have to focus on this. This is not healthy. Why? Because you already have something called disguised unemployment. And if it is rising, notably among women, it's a big problem. Considering manufacturing, it's declining. Services, it's declining. You will notice this trend, particularly after the COVID lockdown. A lot of people who were working in the cities, they moved back to the villages and stayed back there. That is the reason why you will see a rise in agricultural jobs or employment trend. This fact is important, notably among women. Okay. With respect to gender and regional employment, let's see. Rise in female labor force participation. Yes, it's a good thing. And why is it happening in rural areas? Because of the government scheme, National Rural Livelihoods Mission. Female-led MSMEs increased. But in corporate boards, you still have the trend of limited representation. So there is this phenomenon of glass ceiling. Highest female labor force participation rate. Where do you witness? Sikkim. This fact can be important. See, what is the mistake? Just because you see that there is an upward trend in labor force participation, do not automatically assume that there is gender parity. What if they are participating in low value jobs, low wage jobs? So labor force participation doesn't automatically translate into high quality jobs. You need to focus on this also. And this should have been the ideal case. But there are a lot of systemic barriers, social prejudices that are existing. It can also be skill gap. What we need to address this, how do we translate this female labor force participation into gender parity, is a problem to be solved. That can be a mains question also. Wage and earning trends, nothing significant here, but this important trend I want you to understand. See, corporates gained from the corporate tax cuts, etc., and their profitability increased by 22%. But take a look at the wage rate. It is 5 to 9% only. So there is inequality. We haven't witnessed proportionate increase in the wages. High corporate profitability did not translate into employment generation or wage growth. So this will lead to inequality. This is one trend that you need to focus on. Formalization of employment. See, generally, for formal employment, we take a look at the EPFO data. EPFO data says that subscriptions doubled. So we are saying that it can be an indicator of increasing formalization. There is this eShram portal, which talks about informal sector. A rise in the eShram portal and the social security integration also says that, we are slightly moving away from the informalization and situations are getting better. But the mistake that you can do is misinterpretation of this data as a proxy for entire economy. It can be possible that this subscriptions doubling has come from only a few sectors. We don't have the data which sectors are contributing to this rise. So that's something that needs to be addressed. If there is an assumption that the subscription is increasing because of services sector or anything, don't assume anything. We don't have any such data in economic survey. See, these are the usual jobs, but the most important takeaway here is new jobs will come from renewable sector. See, I'll give you an example of this. See, this is the formula for GDP. C plus I plus G plus X minus M. See, we are talking about a consumption-led growth. If C increases, G also increases. Today, the structure of economy is that you're okay to pay, let's say 10 rupees for let's say a biscuit packet like Parle G. But are we going to pay 10 rupees for a healthy snack? The intangible element of demand is not captured here. So if if the entire population together as a whole undergoes a paradigm shift and starts demanding that we would rather pay 10 rupees to a healthy snack rather than a high glucose biscuit packet, that's when you see a structural shift in the economy. What costed 1 rupee would probably cost 10 rupees. That's exactly what is happening with millets. Once upon a time, millets was considered a poor man's food. Now, the value of millets, because of the low production, is so high that it is now considered a rich man's food because there is a structural shift in the demand. There's a paradigm shift in the demand. Similarly, if green jobs or if sustainability becomes a mainstay in our economy, our demand will increase and it will create new jobs. Survey says this renewable sector is going to witness the highest growth rate, and within that, hydropower. Hydropower can contribute to the 40% of the new jobs that are coming after the solar. After hydro, it is solar. Hydro is 1, solar is 2. Please focus on this. We usually assume that it is solar, but it's not the case according to the survey. So this is the revision table of all the schemes. They can directly download and revise. Nothing much here. Take a look at this. Share of jobs in the renewable sector. Number 1, hydropower. Number 2, this can be an interesting fact. Now, let's take a look at the agriculture trends. MSP. Now, MSP for pulses, oilseeds, and nutri cereals. It's significantly higher than what it used to be. And what is the objective here? It promotes crop diversification and income stability for farmers. Then we have what survey says on irrigation and water efficiency. Take a look at this. In India, irrigation coverage is just 8%. US, 68%. We have initiatives like per drop, more crop, micro irrigation fund, which gives 2% subsidy to any person who is willing to create irrigation infrastructure. There is high regional divide also. For example, in states like Punjab, it's as high as 98%. But in states like Jharkhand or Assam, it's less than 20%. So if you ever get a statement like India's irrigation coverage is higher than the global average, it's wrong. It's not even higher than China. It's less than China. Please remember this. Usually in our newspapers, the rhetoric is surrounded around Punjab-like states. That's not the case for the rest of the states in our country. And this statement 1 is very important. So logic here is that it's cute. Remember this fact. This fact needs to be remembered. Very important fact. You can note it down in your notes. Otherwise, you will probably forget this fact. You don't know which fact to focus on, even if I give you this PPT. So if you are attending this lecture, please use it. Try to write down the fact. Next up, agricultural credit. Did it increase? Yes, because of government intervention. Nothing much to remember here. Mechanization. Yes, it increased. Women SHGs receive 80% of the subsidy for drone rentals. We have already spoken about drone rentals in our previous Namo Didi scheme. Okay. So what is the usual mistake done by a lot of aspirants here? Let's say there is a statement, mechanization is fully subsidized for all farmers. That's not the case. It's only partial subsidy for a selected group. So you cannot afford to give 100% subsidy for all the farmers. Next up, marketing infrastructure. Within this agricultural infrastructure fund and ENAM, these are the two important initiatives. Like I told you, this is during 13th to 19th May 2020, when the government, as a part of the Atmanirbhar package to promote spending during the COVID time, it came up with certain initiatives, and one of them is agriculture infra fund. It is meant for ensuring midterm financing. What do you mean by this? Let's say there is an interest subsidy or some kind of an incentive for any person who is willing to create this agricultural infrastructure. The cost of borrowing money from the banks is high. Let's say, for example, it costs around 10% interest. Government will give some X% interest subsidy and it is profitable for the investor. So this fund is to compensate a certain amount of interest, and it is flexible. Like you can, the government through notification can include any scheme, and that's the reason how Namo Didi scheme allows interest subvention through this agriculture infrastructure fund. Similarly, it's a ENAM. Again, like I told you, any digital initiative is very important. Okay. Again, how can this statement be misutilized? ENAM replaces all physical mandis. It's not possible. It's just a contemporary digital solution for increasing access. You still need physical mandis to move your goods and place it there, right? With respect to climate and sustainability, India, according to survey, is moderately sustainable. There is a lot that we can do. The Northeast states are much more sustainable, but the least sustainable ones are Rajasthan. Why? You're witnessing an increasing trend of land degradation here. Desertification trends are increasing. There is something called land degradation atlas. Take a look at this atlas, ISRO's land degradation atlas, and see across time periods how the trend is evolving. So if you have any absolute statements like Indian agriculture is becoming fully climate resilient, not really. Next up, you have certain schemes on allied sectors. Not important here. Like it's very obvious. You can just read it and figure out. In food processing, the confusion is it's often mistaken for an irrigation scheme. Okay. What is this? Please focus. Here also, the ministry in this allied sector, the ministry can be a source of confusion for you. Focus on this. So these are the facts that you have to remember with respect to your economic survey. I'll be putting this document, and without listening to this lecture, if I just put up the document, you're going to be very confused. So I've told you what points to focus, what points to ignore, what trends to focus on. So that concludes our economic survey series. And if there are any facts which I think can be asked, till now I've covered everything. I'll just cover them within the revision classes. In a couple of days, I'll also come up with a document which is like a high priority, high yielding series. It's like a checklist. All the things that you need to do, all the PYQs that you need to do, and predictable terms. This will happen in the second half of April. Predictable questions set. Let's say, of course, you will be having them in the upcoming. You'll be having them in the upcoming full-length tests also. Those who have not written the tests till now, it's okay if you have not written the part test, but do not ignore any full-length test from now on, because it's very likely that questions can come from this full-length test. And this has been the pattern even in the last year. And all the people that you have seen in this meeting, like Tarun or Rohit or Neha, who have been part of this program last year also, they were able to utilize this full-length test and verbatim questions repeated. I don't want to market it like that, but these people will understand facts have helped them in one way or the other to mark the right answers, even in difficult papers. So please, it's a request that do not ignore this full-length test. They will be very difficult. You will not be scoring high, but don't take this scores literally on the face value. Look at the solutions. They will give you a lot of context. See, because I look at a mistake as a opportunity to drive home a point which you usually ignore. What happens when you make a mistake? Firstly, your ego is hurt. And secondly, it causes a lot of disturbance in your mind. See, for example, years ago, you might not remember a question that you have made right. But let's say in your first attempt, like seniors especially, if you have made a question wrong, if it is ridiculously tough, and it haunts you even years later. In one of my attempts, I have one such question which keeps on haunting me. There is a sugarcane initiative or a butterfly initiative, a couple of questions. I was not aware of them at that point of time. We didn't have so much internet back then. So it kept on haunting me till now. I remember that question, but I don't remember the questions that are marked right. I use the same psychological element in my tests, and the full-length test, like you have 600 of them. Every single question is an opportunity to make you revise the theme. So scores are not important, but the takeaway from those tests will be it's a revision mechanism. You need not go back to your books and by heart everything. Even questions can be used as a revision mechanism. Okay, so that's it for now. Any other thing that you want to ask before we conclude? Is that it, guys? Are you ready for the last wing of your last lap of your preparation for this prelims? Be ready to be very stressed from now on. It's okay to be stressed. It's okay to be under a lot of pressure. Just don't have one thing, the fear of failure. Your fear should not cripple you. Probably it's a very different perspective to look at it. If your fear can make you stay vigilant, this is when you will put in this 10-hour, 12-hour thing. I mean, the glorified 10-hour, 12-hour weeks that you talk about. This last 60 days, you will be constantly under a lot of cortisol influence, high amount of stress. So naturally, you will be excited to study more. You will be panicking and you will be exciting. And it's a very interesting phase to be in. It's not sustainable in a long term, but pretty much needed at this point of our. So it's okay if you are stressed. Just normalize it. Okay. We'll be staying in touch. It's not like I'm concluding all my live sessions here. I'll be coming up with a revision schedule also this time. Previously, the last year students did not have this. I'm introducing this interaction sessions periodically. I'll be coming up with high yielding themes and my predictions for 2025 and make you revise those through these sessions. So that's it for now. Any other questions we'll be handling personally in Telegram or on calls. See you guys. Okay.
Okay,
Okay.
thank you, sir.
Chalo.
Thank you, sir.
Bye.
Thank you, sir.